Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more. Hey everyone, I'm the Millennial Mechanical Therapist, and today I want to talk about the phenomenon that we see in the extremities called localization. This week we've been talking about centralization for the spine, whether it be the cervical or the lumbar, but when you come across patients that have extremity pathology or extremity conditions, we oftentimes will see a certain pattern where symptoms will localize to the joint where the condition is. So one of the common patterns that we see is in the shoulder. The referral pattern for a lot of rotator cuff pathology, or at least thought to be rotator cuff pathology, tends to come down the lateral deltoid and kind of to the insertion along the distribution of the supraspinatus a lot of times. Now in that kind of diffuse area on the lateral part of the arm, that's where most people complain of their pain. When you find that directional preference in the extremity, when you're working with somebody with a shoulder pathology, a lot of times as they repeat that motion, their symptoms will become closer and closer and closer to the shoulder and slowly become more pinpoint or more direct and localized into one little spot. Now as that occurs, the pattern that kind of happens is very similar to centralization in that when it becomes more and more direct or more and more pinpoint, it tends to be a little bit more painful in that spot, but overall the condition seems to be improved. Along with that, you really want to be looking for your other baselines, you know, your mechanics such as your range of motion or your strength testing, and oftentimes with other joints in the body, you want to use your functional assessments too. So if it's in the lower extremities, you want to be able to see if this localization correlates with improvement in going upstairs, coming downstairs, hopping, squatting, things like that. Now, the pattern of localization has not been nearly as studied as centralization has, and localization truly has not been mentioned in the literature yet. So this is more of an anecdotal or just a teaching of the MDT system itself rather than anything that the literature is based on. However, if we take the chance of kind of extrapolating what we found in the spine out to the extremities, which is what the system has been doing in general with the repeated movement testing, we've had good success so far with it, so it's certainly something we should try looking into and making sure that we can determine if localization is a good prognostic factor when you're doing repeated movements in the extremities. So taking that thought process, using that localization, that's another key objective finding, at least anecdotally from this point. That is something I always look for when I'm going through extremity joints, and I know Joe does the same thing. So we definitely urge you guys when you're doing repeated movements, especially in the extremities, look for that localization pattern and see if symptoms tend to become smaller and more pinpoint. Oftentimes in the knee it will become a more lateral pain or a more medial pain, but that anterior diffuse knee pain will start to come smaller and smaller and smaller and pinpoint onto that medial or lateral aspect. So take that video with you guys and think about that over the weekend. See what you can, if you have any cases where that kind of happened in the past, or on Monday go in and see if you can find it. As always, move your patients early, move them often, and move them to end range, because that's where the localization happens.